Hello, everybody. My name is Alisha Lee. I'm with Cable Vision TV, and I'm at the 3rd Annual Women's Empowerment Symposium. And this is a Princess Foundation, so let me make sure I shout that out. And I have to say I'm sitting next to a princess. Tell everybody who you are. If they don't know, they will know now.
I'm Dr. Jackie, known by most of America, but in the office, Dr. Jacqueline Walters.
You are an actress. You have a foundation. You are a 2-time cancer survivor. Let's start at any one of those moments.
So, first and foremost, I'm a great friend, a sister, a daughter, all the things that women have to do. Secondly, I am a 2-time breast cancer survivor. I'm an OBGYN by day and sometimes by night. I have a foundation for breast cancer survivors. It's all about, really vanity. It's called 50 Shades of Pink Foundation. It's about looking good and feel good, because we believe if women look good and they feel good, they'll do good. I have a couple of movements today. I'll talk a little bit more about me, period.
Nice.
And it's the me, period movement. It's self-love, self-motivation, and self-determination. I have Fitney. Fit is the new it. I learned, of course, from season 2 of Married to Medicine that I might need to correct the delivery, and that is to remind women to be fit.
Right.
We don't say skinny or fat.
Just fit.
Just fit. And being fit means being whole in your mind, your body, and your spirit. I'm a part of Bravo TV's Married to Medicine. We're starting season 5 in 2 weeks.
Nice.
Yeah. Oh, yeah.
Nice. So let me go back to the breast cancer. 2-time breast cancer survivor. Being that you are a doctor, tell me about that moment when you first found out that you had breast cancer.
Of course, you made a great point. Being a physician, we oftentimes are the fixers and the caregivers, and you never think that you're going to sit on the other side of the knife. And so getting that phone call was a little odd for me, because I didn't actually get the phone call. I made the phone call.
Right.
And I just encourage women, if you get that first call saying come back and do your second look, go. I'm thinking, oh my God, they call everybody, so I'm going to go back and do the second mammogram, and I'm fine. Long story short, I was there, I had a biopsy, and on Monday, I called myself. I'm a doctor. I can just call over and get my results, right? Well, I called and they would call me back, and I'm going to call you back. And finally, I just kind of made a demand, and the pathologist got on the phone to say, you have infiltrating lobular carcinoma. At that very moment, I asked the same question. Right. Now, I absolutely know what carcinoma is, but I'm like, is that cancer? And he, of course, explained that it was, and as weird as it was, I hung the phone up and I kept seeing patients. I just needed to like, it was such a surreal moment to hear, because we always equate cancer to death, and now I've learned that it really isn't all about the death, it's about the strength. The struggles gave me strength. And so diagnosed with breast cancer, chemo for 6 months, radiation for 33 cycles, and on and up on it. And the weird thing about that whole story is I had a pregnancy loss.
Wow.
And at the end of the treatments, I learned that I was infertile from the treatments.
Ooh.
So doing what I do every day is, of course, helping women get pregnant and delivering babies, I couldn't do. And 4 years later, second diagnosis. And you're thinking, okay, God, what is going on? But fortunately, and I guess I can say the only thing I had to do with this one was a double mastectomy and not have any more chemo or radiation. So here we are, and it's all behind us.
I have to know, a lot of times people don't want to take chemo. They don't want to take radiation. So let me ask you, with women going through breast cancer, can you talk to them about that? I know it's best for them to decide with their doctors and their family, but your experience, just tell me a little bit more about that.
I certainly tell women to educate themselves, know the disease that you have, because there are different types of breast cancer. But do sit with a doctor that you're comfortable for, because I think each doctor should give you options.
Right.
There's no one way to treat breast cancer, but there are options. Chemo certainly is there to take care of the systemic disease that has gotten beyond the breast as well as the breast. I'm all about doing whatever the doctors tell me to do.
Right.
I don't think eating You have the patients who say, I'm just going to eat natural and it'll go away. Well, no.
Yeah.
I think we need to treat the disease that's there first and then convert to that all natural living. So I'm all about, if the doctors say do it, do it.
Nice. And let me ask you a question. You started a foundation based upon what you were going through.
Right.
And your foundation is called 50 Shades
50
of...
Shades of Pink Foundation. We believe that everybody who wears a pink ribbon has a different story. Though we're similar, there's something different. But I started the foundation because every time I would go to chemo, I would dress up. I needed lipstick. I wanted to dress up just to make me feel good. Because I knew if I had gone in looking a little not so ladylike that day, it might not have gone so well. So I dressed up to feel good. Then after my chemo, I started, much like the Princess Foundation, I started giving back. I wanted women who had to go through that to have those things that I thought made me look good. So lipstick, polish, scarves, wraps, whatever it was that was comforting for me, I wanted to give it back. And so it started to grow where we would do it for my patients. Then it became my patient's friend and my friend's friends. And so that was the birth of 50 Shades of Pink Foundation.
And what a lot of people may not know, you are also a celebrity doctor. Yeah. We can't disclose their information, but is it okay?
Because it's been on TV.
Okay. So can we tell some people who you are a celebrity doctor to?
My very first celebrity patient was Toni Braxton.
Nice.
And Toni has a strong personality, so coming in, it's like, okay, I got to take charge of this. So we had our moments, but she was absolutely a wonderful patient. And from there, we've taken care of Usher and his first wife, Tramika, and T.I. and Tiny, Tamar and Vince. Oh, and the list goes on.
Wow.
I can't think of the others. And if I forgot their names, it's because I love them.
Amazing. And now let me ask you, as your profession, as being a doctor, there are a lot of women, young women, older women that goes through a lot of health issues. Talk to me about protection. Talk to me about, we say staying fit. Talk to me about some of the things that women sometimes often overlook when it comes to their health.
I think we often forget that we only are going to get one body. I tell women you can get some replacement parts, but you're not going to get but one body. And I always liken it to a car. Like if you take care of a car, it's going to give you those good 10 years, maybe even more. Same thing with your body. You are what you eat. We do know that, your greatest wealth in life is your health. And you get out of it what you put in it. So educate yourself. Part of me theory, again, is self-education. Get to know. We Google everything in the world. And so I often say to ladies, no, I'm not going to create a food plan for you. I'm going to tell you the food groups and how to do it, but you find the foods. And so I'm really all about education, knowing the facts. And all you're getting, get an understanding. If you understand what you need to do, now it's on you to do it. And so you certainly have to take care of your body like you take care of your car and your clothes, because you don't get but one.
Now with today's event, women's empowerment, we focusing a lot on the youth, the young girls, again with the Princess Foundation. I believe there is actually a class going on as well. They're talking about sex and how to talk to their parents about sex. Now there's a lot of teens out there that are maybe a little sexually active, and with sexually activity comes diseases. So unwanted pregnancies, talk to me about that and the importance of protection as well.
And I like how you said it, because now with the new millennials, they really do talk to us. Because the way they process and learn is totally different from the way we did. But I'm still all about the facts. And first I want to shout out the ladies of the Princess Foundation, because having a group of women who would take their time and give back so that they create mature, productive black women in the community is going to make the community better. So I have to give a shout out to those ladies. But the millennials are, you said a little sex. They may be having a lot of sex. But they're very open. They're very free to say, sometimes I have to get them to define sex for me, because they'll say, well, because sex for them is actually just penetration. We're like, no, you're having oral sex. But they do talk to us about it. We still stress protection. HIV, hepatitis, syphilis, gonorrhea, chlamydia, genital. It's so many STDs. and it can change their lives forever. You know, of course, you can still die from some of them, but obviously living with some of the other diseases can change your life.
Let's talk about oral sex because, like you said, some teenagers don't really feel like they're having sex because it's oral. Can you get a disease or cancer because of oral sex, such as throat cancer? And I think that goes mishidden. Is a misconception. Is that true?
You certainly can get STDs orally. HPV obviously is the big one that you might have seen Michael Douglas talk about. That he kind of brought it on the forefront that HPV in the throat is causing throat cancer. You can get gonorrhea in your throat. You can get herpes in your throat, and I think they do forget that you can get. And you know, we don't know a lot about HIV, but obviously if there's any broken mucosa in your mouth and they can get to your bloodstream, you can certainly.
And then one other thing, and then I'm going to move forward to your career as far as acting, but also some women can look out for genital warts that can lead to HPV. Is that correct?
HPV is human papillomavirus, and there are 4 big types. We have 6 and 11, which cause genital warts. We now have a vaccination for it. I strongly encourage all women and men, and they will pay for it. They, as in insurance companies, will pay for it from ages 9 to 26. We encourage them to get vaccinated against 6 and 11. The 2 largest types, 16 and 18, will be a part of that vaccination, which will protect them from cervical cancer. So we strongly encourage that you get your vaccinations. Now, viruses are smart, and it's 20 different high-risk HPVs, but for the big ones, get your vaccinations.
So there you go. So
Let me give it one point. I think oftentimes, again, they think if there's no penetration, that they're immune. But if the wart comes in contact with the genitalia at all, such as, just kind of laying there holding it in place, you can still get HPV. Yeah.
So that's what I'm saying. A lot of young folks, a lot of women, they need to educate themselves about, sexual activities and everything like that. So that's why I'm glad you're here to educate these people.
Right. And the Princess Foundation, again, is doing an event like this, exposing them to the facts. And also just empowering them to make good decisions.
Now let's talk about your career. All right, I won't keep you too much longer. Actress, Bravo.
Well,
married to medicine.
It's not acting,
I'm confused. Is it reality TV? Is it acting? Is it on a strip? Tell me about it.
It's a great question. I was contacted truly by another lady on the show, Dr. Simone, who was a patient of Mariah, to say, these girls are going to put together a show called Married to Medicine. I went on the show truly believing I was going to be a mentor, that I'm just going to mentor these ladies and help them understand the lifestyle of their husbands who are doctors. Well, the long story short, that's not what it was all about. And it truly isn't acting. It's real life. I mean, I wish some of it were acting and I would be a lot happier about some of it. However, it's just being who you are. What they do, of course, is they put you in the same setting and the real person comes out. And so it is, it's reality TV.
You seem so calm. And so if a person comes to you a little erratic, how do you handle that? Like, do you really hold back, or do you say, you know what, I'm just going to let them have it?
No, I think I have a God-given gift or something that I mean, and thinking that you're going to die twice and going through life issues has created a person to say, let me process the information first. I truly believe, and I'll say it again today, that 10% of life is what happens, 90% is how you react to it.
Nice. And you have a book that you're working on, is that right? Being on both sides of the blade?
It is, of course, a lookbook. It's a book because I once went into a boutique and one of the attendants asked me who had messed up my breasts. And he didn't mean it I wasn't even offended. I mean, I was embarrassed for a second, but I thought educating him to let him know that this is my new norm and it's my perfect imperfection. And so I created a book so we can educate women that this is our new norm. This is as perfect as it's going to be for us. And we put survivors and supporters because with supporters, one, they're there to get us through the storm, but two, 1 in 8 of them can have breast cancer the next day.
Nice. And just give a little advice to the women that may be going through or went through or not yet know that they're going to be going through some of the things that you went through, and some positive words of encouragement, something that's going to keep them going throughout life. Just talk to the young ladies right now for me.
Certainly. Storms will come. I mean, it's just a part of life. God never promised us that we would have just a perfect life and we wouldn't go through changes. But I just said it earlier. The 90% is how you react to it. And if you overreact, the problem's still there. So I strongly encourage every woman to, one, get filled with the right words. You are the sum total of the top 5 people you're hanging out with. So hang out with positive people. Great mentors like the ladies here at the Princess Foundation is an asset. These girls will never know how blessed they are until they really need to know. That you need to have mentors. Find some positive affirmations. I would get up every morning and I would declare I was out of debt and all my needs met. I would say this positive affirmation, and then one day I looked up, I'm like, I'm out of debt. And I declare, because if the thoughts talk to me or the problems talk to me, I think I can talk back to them. I remember having breast cancer and me thinking I would die, and I would say I'm going to live and not die. So I strongly encourage, positive thoughts, positive affirmations, great mentors, and great friends will get you through.
Yeah, because you never claimed cancer.
I did not.
You said, I don't have cancer.
Well, I would never say I don't have cancer. I would say the diagnosis they gave me was cancer, because you're right, I didn't want to claim it. I didn't want to say it was a part of me, but I would just say I was diagnosed with breast cancer, because I don't want people to get sometimes so spooky out in there saying what they don't have, and because if you need glasses and I'm driving next to you, I want you to wear your glasses. So I want you to find again to speak to the things that be not as though they were. So right now I was diagnosed with cancer, but I would say I'm healed.
Nice.
Yeah.
Well, thank you so much, Dr. Jackie. Tell everybody how can they follow you and put all your information out there. Thank you.
On Instagram, you can reach me at the real Dr. Jackie. On Twitter, I am Dr. Jackie Walters, and on Facebook, Dr. Jackie.
There you go, Dr. Jackie Walters. Make sure you follow, make sure you support. She's amazing. She's phenomenal. She is here at the Women's Empowerment Symposium. She is doing big things. 50 Shades of Pink, Bravo Network, Married to Medicine, actress. She said she's not, but she's actress. And Dr. Oh yeah, Me Period. The Fit. Yes, please make sure you follow, make sure you support, make sure you reach out. I mean, she's doing amazing things, and make sure you follow the Princess Foundation as well. My name is Alisha Lee, Cablevision, 91.7 FM, jimsradio.net, and of course I got to shout out Doug Oliver and Craig Brown Entertainment. Make sure y'all keep it locked with us. Thanks everybody.